Hello everyone, I'm Laura Lee Fossenbarger with Syracuse Area Health, and today joining me is Dr. Janae Dudgeon, and she's going to speak on a topic that is really important right now, flu season, and we know a lot of people in the area have been sick and having some of those symptoms, so if you could just elaborate a little bit on what exactly are some of the flu symptoms and what are we seeing in the hospital and the clinic right now?
Yeah, so the flu symptoms typically are a runny nose, a sore throat, muscle aches, and the high fevers. So sometimes we think about the flu and we think of a GI bug, but that's not true influenza. True influenza is more respiratory, so.
Okay. Are you seeing a certain demographic hit the hardest? Is it adults? Is it elderly, the young kids? What are you seeing?
So we see it all across the demographics. Of course, we see it more in kids when they're in elementary school and sharing their respiratory bugs, and then we see it in the elderly when they're living in close quarters too, but we see it throughout all ages, so.
Okay, and is there a defined period of time, like when does it start or when is there an ending period for the flu season? What do you see there?
So we typically think that the flu season starts in November. This year it seemed to hit our area the week before Christmas. We always like you to get your flu shot before the season starts, so we say September or October. And then the flu season can go into the spring. So if you haven't got your flu shot, there's still some time to get it and have benefit.
Okay, very good. So some people I hear out there, I got my flu shot, but I still got sick. What do we say to that?
So we definitely do see that. The flu shot isn't 100%, but in those people, we usually see less symptoms. So not as high a fever, or they get better sooner. So there is benefit even if you do have the flu shot and still get the flu.
So maybe tolerable, if that is such a
Yes.
word for
Yeah.
flu season?
Yeah, exactly.
And what about, is there any benefit to getting two flu shots? Maybe one towards early in the season and one towards a few months later towards the end of the season. Is there a benefit to that at all?
The CDC does not recommend that currently, so you should be immune throughout the season.
Okay, so one hopefully will give us the preventative that we need, or at least make it tolerable if that's
Yes.
the case.
Yeah.
All right, well, very good. Thank you very much to Dr. Janae Dudgeon, and she will be joining us again soon on another topic, so we will see you soon. Thank you.